A new day dawns. All across Greene County, the work begins. However, no one knows for sure what lies ahead. When the emergency room doors open, you enter into unfamiliar territory. You hand yourself over to others. Your health, your pain, your fear, your life is now in their hands. For generations, the staff at Greene County Medical Center has tended to the needs of those who've come through their doors, treating the injured and the sick with an unwavering dedication. Healthcare providers, always here, always caring. But tomorrow, a new day dawns, and Greene County Medical Center must again be ready. Preparing for what lies ahead, Greene County Medical Center is investing in tomorrow's care.
As a patient, I feel, like my care is number one on their list when I'm here.
Everybody is always so kind, even if they don't know you.
The staff was fantastic. They were caring.
I could not have asked for greater care from, again, the doctors and nurses at Greene County Medical Center.
We have extremely dedicated staff, very compassionate staff. They provide a great service, a very caring and compassionate service to our community and to those patients on a daily basis.
Greene County Medical Center is situated in Jefferson, Iowa, and provides it and the surrounding communities with inpatient, outpatient, and emergency care services. Greene County is an area spread far and wide, with farming activities and related agricultural industries, as well as other industries that serve the nation and the world. It is important that a full-service hospital be nearby, equipped and ready for any situation.
We're here to provide not only basic health education and medical services, but also emergent medical services.
It's pretty obvious that it's very important when you live in a rural community to have health care close by.
It's a great asset to have here in case of an unfortunate accident.
To have a medical center like this right here in our own backyard, where we can drive a short period of time, short distance, and be in there and have professional help is very beneficial.
My son, when he had his accident, I would say he was here from the field in no less than 15 minutes.
Well, my dad had a heart attack, I don't even know how many years ago.
Several years ago.
A long time ago. And he was taken to the hospital by my mom. She should have called the ambulance, but she took him there. He was having a bad heart attack.
Well, when I first arrived, my son had just gotten here from an accident, a farm accident. And he was in the emergency room, and they were working profusely on him, trying to get him to breathe, trying to get him stabilized.
I had gone to the rec center, again, about 5 o'clock in the morning, lifted weights, drove home, and as I was getting home, my chest started to hurt.
My son had had the best care possible. He passed away on the way to Des Moines in the helicopter, but I have never felt that they didn't do everything that they could do.
So I went into my room and woke my wife up and said, "Don't panic, but I think you need to take me to the emergency room."
He was not in good shape when we got there, and Dr. Marshall knew that he was not in good shape when the helicopter arrived, but he did everything he could to stabilize him and make it so he could get on the helicopter. So they got him there, and things turned out in a positive way.
I'm very fortunate that I'm doing okay now and feel good.
Greene County Medical Center officially opened in 1937. While the staff at Greene County Medical Center has achieved great success serving their patients' medical needs, the issues within the facility continue to be problematic.
They're really individual pods of buildings, and so we struggle sometimes with patients moving from one end to the other, even staff moving from one end to the other.
There seems to be this menagerie of hallways and doors, and I never quite know which doorway I'm supposed to go through, which hallway I'm supposed to go to.
I had to meet with the dietitian at the hospital And that was walking down one hallway, another hallway, taking an elevator ride up, and then going through a couple other hallways past patient rooms to find the dietitian. That wasn't a pleasant experience.
When you pull into the emergency area, when you finally reach it, it looks as if you're going to unload a truck or something there. It looks like a loading dock.
Our emergency room is in the very back corner of our building. It is a struggle for people to find.
To get to the emergency room from the medical surgical area, a nurse will have to go down a long hallway. She can either take stairs or an elevator down 2 stories, and then has to go to the rear of the hospital to reach the emergency room.
I've never seen a setup for an emergency room where you had to buzz in order to be allowed to come into the building for the emergency room.
The double rooms at Greene County Medical Center become quite inconvenient and quite uncomfortable when you have a patient on one side and the proximity is very close.
Investing in tomorrow's care. A campaign to help support the expansion and renovation of the Greene County Medical Center and the investment it's making in its future.
As we look at the Investing in Tomorrow's campaign, we want to make sure that we are able to meet the needs of Greene County for future years, as we hope that the county continues to look at avenues to grow and prosper.
The Investing in Tomorrow's Care campaign focuses around a new addition and an overall remodeling of the campus. A relocated emergency room toward the front of the facility, readily visible upon entry into the campus. A redesigned main entrance to look and feel like a main entrance and includes access to the vast majority of services. A renovated A-level to include the physical rehab department, cardiac services, advanced women's care, West Central orthopedics, physicians' practice offices, and specialty clinics. The combination of these services, all to the A level, improves accessibility as well as sharing space and equipment for efficiency. A connecting corridor to allow patients and staff greater ease and sense of flow from one end of the building to the other and from one level to another. Investing in Tomorrow's Care is a $4 million campaign that responds to the needs of its community members both now and into the future. The services of outpatient, inpatient, and emergency care are vital to any community, but especially one with a deep history of farming, agriculture, and industry.
If you had some health issues, would you want to drive to Ames? Would you want to drive to Des Moines in order to get that health care that you would need in the next 5 minutes?
There's so many benefits of not having to have people driving to longer distances to be seen.
Healthcare is changing so rapidly that if we don't stay with it, we won't have a medical center. People before us have chosen to support it, and I think it's important for our generation to do that also.
When a new day dawns on the Greene County Medical Center, and no one knows for sure what lies ahead, where will you be? Will you be part of the change?
Please join me in investing in tomorrow's care and supporting the Greene County Medical Center campaign.
Your investment can make a difference. Your contribution is investing in tomorrow's care.